another location in Provo. Odyssey House of Utah is the only parents and children's residential programs that actually also has a father and children's program. So when I turn the time over to Adam, he can talk a little bit more about his program specifically for the mothers and the fathers. And then he also knows enough about like House of Hope and some of the other programs that he can jump in on that. Tranquility Home is actually part of Weber Human Services, and they are located in the Ogden area. And then we have Desert Haven, which is part of Southwest Behavioral Health down in St. George. We used to have another program called Valley Phoenix, but again, with funding issues, they had to close down their program. All right, so
Becky,
yeah.
sorry, this is Davy. Your slides aren't advancing if we're just still seeing that first page.
Oh, yes. Actually, thank you. I actually did. I jumped ahead and I didn't advance yet, but I am about to. So
Okay,
thanks for
sorry.
letting. No, no, you're good. Um, all right. So let's see here. Yeah, I did jump ahead. All right. So the residential programs in general, and as all of, many of you are aware, typically there's 24/7 access to the programs. There's usually an intensive therapy focus. There's a focus on life skills development, and there's continuous support. So for individuals that need that level of care, it's often very helpful. And what's fairly special and unique about the parents and children's residential programs is it's really family-centered recovery. So often, and you may know this, that mothers and even fathers have a real difficult time if they have to go into a residential program and leave their kids. So actually, that I'm jumping to the next slide. Here we go. Are you seeing the slide that says importance of family-centered recovery? If someone can say yes, no.
Yep.
Yeah. Okay.
Yes.
Great. Adam, thank you. Um, anyway, so again, what's really important about this family-centered role is that not only are the parents getting care and treatment, but the kids are as well. So there's, the care, for the parents, and then there's therapeutic daycare typically for the kids. Some of the programs will send kids to daycare. And then they join together, and there's a lot of parent-child activities, which are very helpful. So anyway, let me jump on to the next. So some of the key principles of family-centered care include whole family healing that addresses the needs of parents and children, trauma-informed approaches, building trust, safety, and resilience, developmentally appropriate services that include early education and therapy, parenting skill building, unification planning. Often, many of the parents that are referred to these programs are involved with the Division in Child and Family Services and are working on reunification with their kids. The nice thing about this is that kids don't have to go into foster care. They can live with their parents in these residential programs. So again, there's a lot of collaboration, a lot of work with the courts, DCFS, and these systems. So some of the benefits of family-centered care, it really reduces the barriers to treatment for the parents and children. It strengthens family bonds during the recovery process. It also improves long-term outcomes across generations, and then it supports holistic healing and sustainable stability. Um, all right. So I'm not going to jump in and talk about each program separately because I'd like to have more of a discussion, and I'd like to have Adam, if you'd be willing to jump in and first talk about, Odyssey House of Utah and your Parents and Children's Residential Women's and Fathers program, and then we'll kind of go from there.
Sure, happy to. Thanks for having me here. It's great to be here. Again, Adam Cohen, I'm the CEO of Odyssey House. Um, we're a large nonprofit organization based in Utah, serving many different programs as services for people with substance use disorders and people with serious mental illness. One of our One of our programs is our Parents with Children program. This is a huge impact generationally for people with behavioral health conditions, and is one of the most important programs that we operate. Um, so for our organization, and many of them look very similar, House of Hope and Odyssey House look probably the most similar out of the four programs. But we take, as Becky indicated, mothers, pregnant women, and mothers with dependent children up to age 10 in residential treatment, and then dads with their children up to age 10. And we can be flexible on age if it's clinically appropriate for that individual, for the child to be there if they're like 11 or turn 11 in the program. So again, we will work with pregnant and parenting women and parenting men. If the mother is pregnant, we connect them with a really great clinic at the University of Utah, the Super Rad Clinic, that helps with any withdrawal management that they might have if they're an opioid user. And then that clinic will help with their OBGYN services and delivery, and then post care for medical. And then they're residing with us in residential treatment together. So, uh, again, people who are appropriate for this setting are individuals who have a diagnosed severe substance use disorder with a co occurring mental health condition. Um, and for the parents side of things, the parents get intensive treatment during the day. They will do individual, group, and family therapy uh, in the program, skills development services, behavior management, reunification services, parenting classes, all of that kind of stuff. For the children for at Odyssey House and House of Hope, we each have a therapeutic daycare. So we have clinical staff in a daycare setting that we operate that focuses on healing the child's own wounds from their parents' substance use and behavioral health conditions, and then also get them pre-K readiness. As you might imagine, many of these children have behavioral health conditions of their own, and also are developmentally delayed in some cases, and we help to get them prepared for kindergarten. For school age kids, we have a partnership with a local public school. The children will go to school during the day, and then we'll come back to our therapeutic daycare after school and participate in clinical services. And then we reunify all the families at night and do bedtime routines, any family therapy that needs to happen at that point as well. And yeah, so as far as like the complexion of people who are coming to the program, about half of the individuals that are half of the families that are coming into treatment are involved with the Division of Child and Family Services, where the child has been removed from the home, and we are acting as a trial home placement for this family to ultimately reunify with their parents. The other half are either at risk of getting involved with the DCFS system, or just have a diagnosed substance use problem and need to bring their children to treatment with them. Parents with Children treatment was born out of the barriers for, in particular, women entering substance use treatment because they have children and they can't leave them. And so that kind of started in the early 90s. And then as we've operated these programs for many years, we understood that the children have just as many issues of their own, and our goal is to treat the whole family as a unit and have them live their healthiest lives. Um, so we can then step them down into outpatient care, and we do operate transitional housing for families who are leaving residential treatment if it's appropriate for them to remain in the Salt Lake City area. Again, there's programs across the state, but each of the programs take people from throughout any region of the state. Um, as far as payers, Medicaid is the primary payer for these types of services, although, at least for my organization, we do take commercial insurance if that's available for the family. But most of the people that we're talking about are very low income, multi generational poverty, behavioral health conditions, and domestic violence and all of that kind of stuff. So that's kind of a basic overview of Odyssey House's Parents with Children program, and kind of maps over the other three organizations that run these services. So yeah.
Thank you, Adam. That's really helpful. Adam just has so much vast experience in this area and so much knowledge. So he's definitely somebody that, if you have have questions to go to. I'm not going through all the slides, but each slide has more detailed information on each of the programs, including their contact information. So if you have individuals that you need to get into treatment through one of these programs, you just contact them directly. Is that correct, Adam, for also your program?
Yep. Yep.
Yeah. Would you mind talking a little more also about like the fathers and children's and how that developed? And because I think, again, this is really unique. You don't see
Yeah.
this very often.
Yeah, we're I think one of the only, if not the only, Fathers of Children program in the country. Um, and the Fathers of Children program we opened because in 2005, during the peak of the methamphetamine crisis that we were going through, and at the time there were children going into foster care because the mother was unable to parent the child, but the father was able to, but there wasn't a, a a place for them to engage in services. So we opened up the Fathers of Children program to allow for access for dads to parent their children when, let's say, the mom is in prison because of her behavioral health conditions and criminal history. So yeah, and it looks very similar. The treatment is integrated with the moms and dads doing treatment during the day together, and the children are all together in their services in the therapeutic daycare. And but yeah, it removes barriers and prevents children from going into the child welfare system and into foster care. And that ultimately, the ultimate goal of this is one to treat the parents' identified substance use problem and co-occurring mental health condition, but really more importantly is to keep families together and reunify families where possible. I think maybe one of the data points that's important to note, DCFS had studied these programs in relation to the treatment as usual for the child welfare system for parents who have substance use disorders. So treatment as usual with DCFS, if they're just going through the system and not engaging in services, the reunification rate is about between 25 and 30%. When they're participating in these types of services, the reunification rate approaches 80%. So really, it's having a significant impact on Utah's youth and really keeping families intact. And beyond that, those 80% of cases never re-enter the child welfare system again. And that's really the goal that we ultimately want, is that children are growing up with their families and they're living in a safe, healthy environment. And so these programs really do have significant impact generationally.
Yeah, absolutely. Thanks. Thank you, Adam, for sharing that. Maybe we'll pause for a minute. Does anyone have any questions about these programs?
Adam, I apologize if you said this, but how many beds do you have, or how many families can you have in your facility at a time?
Yeah, that's a great question. We can have 16 adults and 35 children. So 16 families can be in treatment at any given point in the residential setting. And then we have 140 beds of transitional housing that's kind of some of them are family and some of them are single adults that are in those services. But if there's a need, we'll kind of rearrange apartments and make a family unit available if that's the case. So we do have flexibility on moving people throughout the continuum of care and adapting to whatever the need is. Also, I should state the children can come at any stage, so they can be in the womb, just barely born, born in the program, all the way through age 10. And sometimes family situations are complicated, so sometimes we'll reunify one child before another child because they're um, in foster care or a temporary placement, and getting all the stars to align sometimes takes a little bit. So the family doesn't have to be intact at admission. That can happen throughout their treatment stay. I would also state, I know House of Hope has capacity for 40 families, and I think the Southwest and Weber are smaller. They're like 10 or less beds, 10 or less adult beds.
Yeah.
Thank you.
Mhm. Any other questions?
I have a question. Um, for this program, do they need to have insurance, Medicaid, or parents and children? Do they have to have insurance?
No. So we will help anybody who comes to our door get enrolled in the Medicaid program, or help them navigate the ACA marketplace if they don't have coverage. It's also important to note that all four of these programs are contracted with the local authority system and the state. So we do have some funds available for completely uninsured individuals who are ineligible for any type of insurance, including Medicaid. So we can get them funded from a federal block grant that is matched by the state and the counties to make this work. So really anybody can come to the door and we'll help them navigate whatever funding they might need. We also help them get on SNAP and food stamps if that's appropriate for them as well.
Okay, thank you.
Mhm. Looks
Let's
like
see
Eric.
Yeah. Hi there. I'm just curious of what sort of supports when the family, for lack of better terms, discharges back to the community. What ongoing support is offered? With this being a group of care coordinators, we're always eager to try to help families, with kids with special healthcare needs or what have you, to try and make sure they maybe have some adequate follow-up, or that we can try to help families face any barriers that they might encounter when they're back in the community.
Sure. I would so a major portion of any of these programs, we kind of act as the hub of the wheel and kind of help to get them out into the community to whatever services are needed. So if they have medical issues, that the children have medical issues, we'll connect them with a local hospital system or clinic that is appropriate. If they like, let's say we have a child with autism, we'll connect them with like Pingree Center, or have them attend the Children's Center if they have other behavioral health needs that we couldn't do internally. Um, and then upon discharge from residential treatment, for my organization, we have transitional housing. So we will transition them if it's appropriate for them to go into transitional housing, and we continue to case manage them while they're in transitional housing and outpatient treatment. But really, the more the merrier. So if people want to get involved with helping to navigate with these individuals, the more the merrier. Also, I would state that all of our services have free aftercare so they can come back and engage in recovery support services for the rest of their lives should they want to. But oftentimes it's an integrated approach through all types of service providers, so we could use as much help as possible because these families are fragile.
And Adam, correct me if I'm wrong. So the House of Hope has like this legacy luncheon every year where all the alumni members, come to this luncheon and there's a celebration. And I mean, there's just ongoing support in so many ways, but that's correct, right, Adam? That it's kind of like the alumni come to this and the public and anybody that wants to come to the event.
Yep, House of Hope does. It's a great event. Like they have lunch and tea, and it's great. But I mean, for all of the programs, recovery is about community and about engagement with that community, and it's maybe not just our own community. It's also connecting them to to other recovery or pro social activities in the community. So I can use some examples within my organization. We connect them with Fit to Recover, which is a sober gym. So the parents can go to the gym in a recovery environment and learn those skills. We connect them with USARA, which is a recovery community organization that has statewide reach and offers recovery support services. So it's not just insulated to our organizations. It's really about connecting them with local resources in the community to diversify the their connection to the community.
Yeah, there's so many great things I think about these programs and the services they offer, the ongoing support. I think they're pretty amazing programs. So thank you to Adam and others, that actually run these programs because again, it's not an easy task with multiple things going on with the parents and the kids, the costs. I think that many of these programs take on a lot of the cost on their own, right, Adam? That you're not making money off these programs at all.
No, not at all. They're very expensive to operate, and I mean, it's core to our mission. So we figure out ways to raise funds to keep these open. Um, but yeah, it's a braided funding approach, and often philanthropy is a significant um, addition to making the ends meet.
Yeah. And even this presentation, so what we've done over the past years, try to bring awareness to these programs. And so we've presented to various organizations and places. And if there are places you think or organizations you think this presentation could be beneficial, we would be happy to come and present. So just let us know. Oh, Eric, another question?
I'm sorry, I had one last question. And I may have missed it. Do the folks who enroll in the program, do they need to be a resident of the county in which the program is offered, or do you take folks from across the state? We have a lot of rural and frontier areas in the state, and we contract with four of our local health departments, San Juan, Southeast, Central, and Tri-County. So we have an amazing boots on the ground care coordinator in those areas. I just wasn't sure like what, the ability to refer from outside of one of the counties where you have a facility.
Yeah, great question. They are statewide. Um, uh, I know Odyssey House, I'm pretty sure House of Hope has contracts with all the local mental health authorities. So we would be like, if they're, say, in Carbon County, which we get quite a number of people from there as well. If they're from there, we will work with the local mental health authority um, to use their Medicaid system to pay for the treatment of them of their patient, and that, like, outside of the Wasatch Front and really outside of Salt Lake County, most of your highest level of treatment services are here, and so we have connections even in other areas, like for single adults or people with serious mental illness, like we have contracts to make sure that those services are available to people in rural and frontier areas where it's not practical to have a substance use residential program. So I hope that answers.
Yeah. Which is great to have the statewide programs. So, other questions? So you all actually have a copy of this PDF of the PowerPoint with, again, very specific information. I'm sorry, I'm just jumping to the very end, which has my contact information, and Adam's contact information is on the House of Hope slide page. Um, Sorry, I'm just getting to the last page. All right. Yeah. Other questions? That was a very fast presentation, huh? No.
One last question. Um, do you guys need a referral or that any person just can contact you to get into the program?
Yeah, so any and all. So we get referrals from the parent themselves, the family of the parent, any care coordinator could, hospital systems, DCFS, the courts will often refer. So really any avenue to connect them with our front door, we are able to pick up the ball and run from there.
And
Thank you.
I thought of a question as well. What what happens if all your beds are full at the time that people contact? Do you guys have a waiting list? Do you know the average wait times? Does it fluctuate a lot?
Um, yeah, that's a great question. Uh, for my organization, if the parent if we are full in the Parents with Children program, we can oftentimes place the adult parent into one of our single adult programs while they wait for a bed to open in the Parents with Children program, and then we would reunify the kids as soon as that bed is available. So it does fluctuate on capacity, but within the entire system, there's usually some type of bed available somewhere to get people engaged as soon as possible.
Great. Do we have any other final questions for Becky and Adam? Well, I will be sure and share these slides on our Trello board. Since we have a couple minutes, I'm going to go ahead and share my screen again. Um, I've fixed the mid-year evaluation link, so I'll go ahead and put that back up for everybody to take a couple minutes to look at. I also realized that I failed to hit record until our learning session started, so I might flip back through the announcements as well so that they can be part of the recording and for anyone who joined us a little bit later. But I'll go ahead and leave that link up for just a minute, and then I'll go over re-announce some of the things I announced. But in the meantime, does anybody else have anything you'd like to share or thoughts that have come to mind from today's presentation? While you all are working on the mid-year evaluation, I did want to let you know, I know last month we talked a little bit about the idea of doing a Mastering Medicaid workshop just for UCCCN members. And we are in the process of organizing that. It looks like it's going to take place in October. And it will replace our October meeting, but be on a different day. So just be aware of that. It will be on the third Tuesday of the month, the 20th, instead of the third Wednesday of the month. So I'll make sure you get the appropriate invites and everything for that as the time gets closer. And that will be an in-person workshop that will be held at the Department of Health building that we met at last year. And then we'll have to do a little shuffling on topics for the rest of the year too, just as we are fitting in this Mastering Medicaid workshop. So I'll have an updated calendar probably at our next meeting for what the rest of the year will look like for that. And then, okay, I'm going to go back over. Oh, and then just the other announcement I wanted to share is that our October, or sorry, not our October, our April, wow, our August, rather, our August meeting will be about special education services. And we'll have the Utah Parent Center come present for that. So just a reminder, announcements. Transition Summit is happening in October at Primary Children's. Registration is currently open for that. Again, all these links and everything will be available on the Trello board and in the notes summary I send out. There's another a Utah Home Visiting Program Summit on September 15th. I thought some from this group might be interested in attending as well. That'll be in West Valley City, and registration is open for that as well until August 5th. And then this is a research opportunity available through the University of Utah, a provider at the University of Utah studying a play-based movement game for children with intellectual and developmental disabilities. And it's open for families to enroll with some compensation available for those that are eligible to participate. All right, so that is our announcements for today at the end of the meeting as well as the beginning. All right, well, we'll go ahead and wrap a little early today since that's all we have, unless anybody has anything else they want to jump in on. All right, we'll plan to see everybody in August. Thanks, everyone.